Good evening, I'm Karen Swenson.
And I'm Mike Hall.
Well, they're two of the most popular cosmetic procedures in the U.S., liposuction and Botox injections.
And now doctors say they can use them to actually sculpt your body. Medical reporter Meg Farah shows us the amazing results in tonight's Wrinkle-Free Friday.
Liposuction is no longer just for sucking out fat.
I would say every other patient that comes in for body contouring will now inquire about some form of sculpting or etching.
Patients want to lose inches and get instant ab muscles.
So you can create that 6-pack or 12-pack or 2-pack, whatever you want, through very tiny incisions and with very little trauma. It is absolutely beautiful.
What do your friends say when they see it?
They can't believe it, they saw it. Nobody can believe that it came out like that.
I would do it again if I needed to do it again, especially with this physician. I did my homework, I asked around, I got on the internet and did a lot of research.
The buttocks, hips, and thighs can also be sculpted, and doctors say the results will last if you don't gain weight. But they say surgeons need to have the very specialized etching cannulas and lots of experience.
You have to have sort of an experience and elevate your train of thought to be able to kind of see what's underneath the skin.
Patients are usually in their 20s to early 40s. Older skin may be too stretched out. And patients come in from all walks of life, including the Hollywood celebrities.
We have some celebrities that come. We do have people who are politicians that come and people who are in the public eye, including media people. You'd be surprised what lengths people will take to ensure their privacy.
But if you'd like the sculpting without the scalpel or general anesthesia, doctors are using Botox in new ways. While it's only temporary, lasting 4 months or so, it's no longer injected just in the forehead to get rid of wrinkles. It can now be used to get rid of gummy smiles in younger people by relaxing the upper lip. Doctors are able to get rid of those marionette lines going downward from the corner of the mouth. Those ropey-looking lines in the neck can be injected and softened. It's being used as a chemical brow lift, raising the eyebrows 1 to 3 millimeters to open up the eyes. And people with round faces can get injected and give their faces a more oval look. And you can change the shape of your eyes, making them bigger looking and rounder, staying that way even when you smile. For older people, you can bring out the lip that is turned inside of the mouth. But even with all of this, Botox is still only FDA approved for what doctors call losing your 11. It's those 2 deep lines between the brows.
It's the area that has the biggest wow. You know, it's when you lose your 11, it changes your facial expression from negative to positive.
Nashville's Dr. Deborah Sherman is one of the small number of ophthalmic plastic surgeons in the U.S., and she teaches Botox techniques. But because sculpting is very dependent on the doctor injecting the exact amount in the precise muscle, she has a warning.
In the hands of a master physician, it's possible to lose the lines without losing expression. So you see, it is an art, and no one should trust their face to an untrained physician.
And doctors say the Botox problems you've heard about in the news were from doctors using cheap, fake Botox.
The moral to the story with the bootleg Botox is know your doctor, go to a board-certified aesthetic physician, a physician who is skilled at facial aesthetic techniques.
For Wrinkle-Free Friday, I'm Meg Farah.
Liposuction with the etching technique costs a little bit more because it takes longer in the OR, and Botox injections range from $300 to $500 every 4 to 6 months.